have a quorum.
The Secretary tells me y'all look like a quorum. The first item on the agenda is Senate Bill 2350, which I assume has come to us from Judiciary. I'm assuming this is a technical matter to help get this document, but Senator Kaufman introduced the bill. Would you please?
Sure. Thank you, Mr. Chairman. This is a bill I filed for several years and we've never gotten it passed. Love to see it go through this year. Right now, these parents are going overseas and adopting these kids and spending $45,000, $50,000. And then they come back over here and, later on something happens to the birth certificate and they have to go back through the readoption process once again and spend another $4,000 or $5,000 in doing that just to get another birth certificate. This would just allow them to be able to get a birth certificate, just like us. Whenever we need a new birth certificate, we go and pay for one and get one. This would just allow them to be able to do the same thing. So that's simply what the bill does.
Questions? Senator Hobson.
Thank you, Mr. Chairman. I brought up these questions in Judiciary A, and Senator Kaufman, I recognize the intent of the bill. We do have a process that we passed and created several years ago that allows for these foreign adoptions to take place and come back to America and come back to Mississippi and get them certified in the court system. And I asked this question: why cannot the court order from that prior adoption be used to get the additional papers they need from the Bureau of Vital Statistics?
I wish I had a good answer to that, but I'm not real sure why.
I wonder if the people that are pushing for this are trying to get around going through the court system to be able to get their adoption papers.
I don't think that they are. I think they're just trying to make it a simpler process, an easier process, just to be able to get that birth certificate. Yeah,
I said this in the committee meeting. I think I was chairing Judiciary A at the time and maybe handled the bill. Senator Parker and I both remember it. I'm still confused as to why this is needed, because it seems like they ought to be able to go through the court system when they get their adoption certified in Mississippi. And then after that, they would have the order of the court or have access to it to be able to get the papers. And just, Mr. Chair, if I may, just by way of recollection on what we did then, we want to make sure they go through the court system, because you don't want somebody bringing some papers from Tajikistan or someplace and you don't know what happened and if it's legitimate. I mean, there's some places that may not have, you go through this process and you don't know if it's legitimate adoption or not. So you don't want to create a black market situation where people are taking kids, they get some paper and you're not going through the court system where they're verified, or at least somebody can look into it in more depth. So I'm a little concerned that this may be getting around the court system issue. And I just frankly I'd like to get some more information before we pass this any further. Thank you. If you have a response to it, I'm happy to. If there's some explanation, I just haven't heard an explanation enough to make me feel comfortable that we're not going to circumvent what is the legitimate process to get these children officially adopted and certified here in America and Mississippi.
Yeah, I wish I could give a good answer to that, but I'm not real sure. I just know that I've talked to folks who are spending, like I said, $45,000 to $50,000 going through all the processes they're supposed to go through to get these children adopted, bringing them here in these good Christian loving homes. And, something happens to a birth certificate, they have to spend another $4,000 to $5,000. They're telling me to get another birth certificate. They have to be readopted is what they say.
I can just about assure you, you can get an adoption done for less than $4,000 in Monroe County. But, these lawyers in Hinds County, they have all these tall buildings, all these offices. They ought to pay for them somehow. So I think lawyers out in the sticks are cheaper. Just saying. Is there further debate on the bill? If not, are you ready to vote? There's a motion title sufficient to pass. All in favor say aye. Aye. All opposed, no. It appears the ayes have it. The ayes have it. We'll report that to the Senate. Senate Bill 2421 is an existing program which allows grants to be made to qualified health centers insofar as money is made available through the appropriations process for this purpose. What this bill does is simply extend the existing program until July of 2024. This is merely authorization as to whether the Appropriations Committee puts any money in this program or not. That's up to them. There's a motion to title sufficient to pass. Is there discussion or debate on the bill? Are you ready to vote? All in favor say aye. All opposed say no. The ayes appear to have it. The ayes have it. Senate Bill 2725 is a bill which does exactly what it says. It says that a healthcare provider or its agents or both have to give you your records within 30 days from the date you've made a valid request. Senator Wiggins.
Question.
Yes.
Mr. Chairman, or to the author, I like the bill. My question is, what's the enforcement mechanism should they not comply? Looking at the bill, there is no enforcement mechanism.
Well, I think, Senator McMahon can speak for himself. I think his ideal was if we get the bill on the books, that it will at least be something you can waive in front of these people and that might have a salutary effect. But
Forgive me for being so distrusting, but 30-day, if there's no enforcement mechanism and 30 days passes, they just tend to look the other way. So that's my question.
well, Senator McMahon, what are your thoughts about all that?
Senator Wiggins, it's a good question. I would think that you could just seek an order from a judge to enforce it. I intentionally wrote the bill as simply as I could write it so that patients have a right to secure their billing and medical records within 30 days of written request.
So if they request their own medical records, the intent is that they be given them within 30 days.
Correct. Or their medical records or billing records. That's
Right.
correct.
Okay. I just raised the issue. I think it's a good bill. I just raised the issue that there will be those out there who choose not to comply, and then we can't hold their feet to the fire.
If you want to offer an amendment on the floor, we could discuss it and then put something on the floor. Happy to work with you.
That's fine. Thank you.
I appreciate your spirit to be sure that people get their billing and their billing records and their medical records. I appreciate that. I really do. Thank you.
Speaking for myself, I've never had any problem getting the bills. But, there's a motion title sufficient to pass. You ready to vote? All in favor say aye. All opposed, no. The ayes appear to have it. The ayes have it. Senate Bill 2735 is a bill which attempts to establish some emergency rooms in extremely rural areas which do not have access to them. I frankly cannot tell you whether this bill will result in any emergency rooms being constructed or not. But in particular, there's an interest in Houston, Mississippi about having a freestanding emergency room. There's sort of a unusual situation in Houston in that they have a hospital, but the hospital doesn't have an emergency room. But regardless of whether this does or does not produce any such facilities, the people in these areas, in particular, Senator Super at Houston is interested in that. The bill is drafted in such a way, and there's an attempt to make sure that the facilities are located in such an area Uh, There is in the committee sub a provision that the emergency room be 35 miles from the nearest hospital-based emergency room. I think we may need to get consent to change that to 15 miles. Well, no, I think that's taken, I'm sorry, I think that's taken care of. I would give a brief window there. Are there questions on the bill? Ready to vote? I'm sorry, Senator Barnett.
Yes, sir. Thank you, Mr. Chairman. I was just clarifying, did you say that the nearest hospital would have to be within 35 miles?
The way the bill is drafted is that if an emergency room is established on or before July 1st, that it could be done within 35 miles, otherwise within 15. It suits me, and I declare I didn't see this provision when I read the bill. It suits me to have that just simply read 15 miles.
I guess the reason why I'm asking, I just wanted to make sure that like Bay Springs is maybe like 30 miles from Laurel, where there's already a hospital.
I think the solution would be just to offer an amendment to make that 15 miles.
No less or no more than 15 miles?
You can't be within 15 miles of another emergency.
No. I wasn't trying to prevent it. I just want to make sure that if one was over 15 miles, like 30 miles, then it would still fit into what this bill was asking us all.
If you want the law to apply to your area, you need to say that the prohibited area is 15 miles. And the way the bill is drafted, it says the prohibited area is 35 miles. Senator Horn makes that motion. Are you want to vote on that motion? All in favor of that change to the sub, say aye. Opposed, no. The ayes appear to have it. The ayes have it.
So question,
Senator
Mr.
Parker.
Chairman. Just looking back to the existing code. I guess I'm a little confused because the existing code right now says in order to be eligible for licensure under this chapter, the freestanding emergency room shall be located at least 15 miles from the nearest hospital-based emergency room. And so on the committee sub, again, I'm just digesting this as we go along here. Are we not changing the committee sub back to?
Let me ask this question. Do we have a copy? Can we get copies of the bill as originally introduced?
I've got it right here.
If we could get copies for the committee of 2735 as originally introduced, if there's a motion to label this on the table subject to call, we'll go back to the original bill.
I'll make that motion.
All in favor?
Aye.
All opposed? Ayes have it. Thank you. I believe that Senate Bill, the committee sub for Senate Bill 2818 merely brings forward an existing code section.
Mr. Chairman, if that's
Senator Parker.
That does indeed look to be what is going on in the committee sub, so I'll make the motion. Title sufficient, do pass. I'm sure you've got a purpose for this.
Well, assuming that the committee sub merely does bring forward code sections, which is what I think it does. This is to have on the calendar a bill that deals with the code sections involving the State Department of Health. It is possible that we would need to make some technical changes to the Department of Health law. My intention and my belief is that we would only do this if there was some sort of consensus about it, but we're coming up on a deadline and we need a vehicle. So the purpose of this bill is not to establish the grant program, which the short title says. The purpose is merely to get a vehicle alive so that we can get by tomorrow's deadline. That's what the bill does, and that's the reason.
Title sufficient, do pass.
You ready to vote? Title sufficient, do pass, committee sub. All in favor say aye. All opposed, no. The ayes appear to have it. The ayes have it. Senate Bill 2820 is the statutory law that we need for the COVID money to allow money to flow to hospitals. Again, I have been told that it would be useful to have this vehicle. The committee sub includes a reverse repealer, and this is doubly referred to appropriations. My thought is that if the Appropriations Committee feels like we need statutory language to bring about what they're trying to do, that we should send this to the Appropriations Committee and let them make that determination. The Chairman of Appropriations moves title sufficient to pass. All in favor say aye. All opposed, no. Ayes appear to have it. The ayes do have it. We'll report that to the Appropriations Committee. Have we been able to get copies of Senate Bill 2421, I'm sorry, 2735 as introduced? I'm sorry, the committee substitute that I reviewed for this bill is not the committee substitute that was included in the package, and I don't know what's going on, but if we can get back on the original bill, I think we'll be okay. I think the original bill is introduced accomplishes what we're trying to do, and the underlying language on line 149. So that's what the bill does. Is there a motion on the bill? Motion's title sufficient to pass. Is there debate? Senator Barnett, I think this takes care of your situation. All in favor say aye. All opposed, no. The ayes appear to have it. The ayes have it. I think those are, I'm not overlooking something on the calendar. Am I okay? There were a couple of bills introduced regarding a mandate to require hospitals and nursing homes to allow in-person visitation under certain circumstances. Members have talked to me about that. I know Senator McMahon has a bill. There are other members that are not on the committee that have talked to me. I'm reluctant to put into statutory law or requirement that's quite that specific, particularly with this pandemic going on. I think the one thing we've learned about the pandemic is we do not know what the world's going to be like 6 months from now. On the other hand, I have talked with both the nursing homes and the hospitals and made them aware of the strong feelings of members of the legislature. And they have indicated to me that they will review their policies with an eye toward trying to make greater efforts for personal visitation. The nursing homes tell me that at least in many nursing homes, there's currently in-person visitation right now. And the hospitals mentioned that it was to their own best interest to have people visit, because if there are, and if you had someone in the hospital, you know this, if there's a family member or someone in the hospital room, that in fact helps the hospital because that individual can do things that otherwise some hospital employee would have to do. But that's where we are on that. We meet every year, and if the situation does not improve, we'll be convening again in January. Also, there's been legislation concerning nurse practitioners, which we have discussed and had hearings about. And I've talked not to all the members of the committee, but I've talked to many members of the committee. And given where we are now, I do not intend to bring that bill up before the committee. And this is a decision that I've made, and it's my decision alone, although I've talked to members of the committee. I'm sure everyone would like an explanation, and I will try. First of all, I think the existing situation is perhaps the worst of all possible worlds. We have a requirement which is called collaboration, which is in fact review of hospital records, medical records after the fact is over. There is some benefit in that. I think that's done routinely, but that is not the way Noah Webster would describe the word collaboration. I don't know how that legislation came about. If I had to guess, I would guess it was an attempt of a previous legislature to reach a compromise, and what they reached was, I think, not a very good one. Since we began having our hearings, and I would say this, the reason one has hearings, at least in my opinion, is to learn things one doesn't know. And during the course of the hearings, I became concerned about several things. One of those being the education that advanced practice nurses receive. I do not believe that is standardized. I'm very much concerned about the degrees that are granted by distant learning. I'm concerned about the quality control with some of the degree granting entities that are out there. And nothing during the course of the hearing has made me feel any better about that. And I'm particularly concerned about Walden University, which I think is an example of a school without high admission standards. It's not to say that there are not people that go there and finish that are very fine nurses, but I don't believe there is the quality control there. I've talked with people on the committee, and many of the people I talk with, if not most, who have feelings one way or another, seem also to think that there are a good number of reasons that they have, I won't say misgivings, but that's the word best I can come up with about their position. a number of people who do not think we should go forward with the bill believe that the current system is untenable, and I believe that too. But many people who do generally support advanced practice, independent practice for advanced nurse practitioners under many circumstances are also uncomfortable with exactly how to identify the nurses that would be allowed to do this. There's discussions of hours, additional training, but I think that we have learned through the hearings that the quality of the training and the rigor and the quality checks are more important or equally important as just the number of hours. There is also my concern that this would be regulated by the Board of Nursing. It is not necessarily the case that those who are on the board, which are doing the regulating, themselves would be qualified to be advanced practice nurse practitioners. And I think there's a quality control issue there also. So I've come to the conclusion that it's not in the best interest of all of us at this time to go forward with this particular piece of legislation. I do believe, however, that there need to be changes made to the current system and that we need to try to continue to find some type of training or some set of guidelines or regulations that might make things possible for a larger number of nurses. Having said that, if there's a motion to rise and report. So, motion to rise and report.
I needed to enter a motion to reconsider on something,
Okay,
on 2350.
okay.
And may I speak to it if you?
Yes, you're welcome. You're recognized to speak to that.
I serve on Judiciary A, and I don't know if the chairman recalls, we laid this bill on the table. It's still the property of Judiciary A because there was extensive discussion related to this, and the chair of the ad hoc committee, that I was speaking about it, and then the chair said to me, there's a superseding motion. And then the superseding motion was to lay the bill on the table. And we voted to lay it on the table. And it's still in judiciary.
The bill was reported to us, and all we know is that we have a message telling us the bill was reported from Judiciary A to Public Health.
And I think our assistant was kind of.
Perhaps that's so, but this is a matter for division or for Judiciary A, and in particular, the chair of Jud A. The bill was first referred to Jud A, and the chair of Jud A will control the bill on the calendar. So if there's a mistake, then the way that would be resolved would be for the chair of Jud A not to call the bill up on the calendar. With that being said, do you want us to vote on your motion to reconsider? Okay, well, I would encourage you to talk to the chair of Jud A, and if a mistake's made in Jud A, if the chair just doesn't call the bill up, that solves that problem. There's a motion to rise and report. All in favor say aye. Opposed, no. The ayes have it. Thank you.